Hello, this is video 11, part 1 of the Introducing Herbal Medicine course. This video is entitled Insulin Resistance and PCOS. What is insulin resistance, or IRS, insulin resistance syndrome? This is the name given when the body cells don't respond properly to the hormone insulin. IRS is the driving force that leads to type 2 diabetes, diabetes in pregnancy, and PCOS, polycystic ovarian syndrome, in the pre-diabetic, which is a pre-diabetic state. Insulin resistance syndrome is strongly associated with obesity, and reducing insulin resistance can be achieved with weight loss, exercise, and low carbohydrate diets, and any carbohydrates that are eaten are low glycemic index, like these breads illustrated here. So the role of insulin in the body, this is to allow glucose to enter the cells of the body. Without that, they can't enter. The glucose is then used as an energy source. Insulin resistance means that glucose can't enter the cell, and so the blood glucose levels are actually raised. When the body becomes resistant to insulin, the pancreas tries to cope by producing more insulin. So people with insulin resistance syndrome often are producing more insulin than normal, and this can promote inflammation and drive hormonal changes, and this is especially so in women. So looking at what happens, so using the pointer here, eating too much carbohydrates, especially those with a low glycemic index like refined carbohydrates, will cause rapid increase in blood glucose. This stimulates insulin production, will increase blood insulin levels, and if constantly part of the diet every day, will lead to a permanently raised insulin level. So insulin is a double-edged sword, and it can increase inflammation, but obviously it will promote energy production to allow the glucose to enter the cell, but it also encourages fat storage, and it inhibits fat burning. So all these things would be against weight loss, of course. So the effects of high insulin levels on hormone balance in women are that higher than normal levels of estrogen may be produced. So a situation of what they call estrogen dominance over progesterone may contribute to abnormalities in the menstrual cycle. So short menstrual cycles, long menstrual cycles, heavy menstrual cycles, for example. And there is also raised testosterone in women, and this can cause acne, an increase in facial hair, and even male pattern baldness or hair loss from the scalp, but that's driven genetically to some extent. Polycystic ovarian syndrome, the main feature is a changed menstrual cycle, but it is definitely caused by inflammation and causes hormone imbalance. Underdeveloped follicles accumulate in the ovaries, and the polycystic ovaries can enlarge, be larger than normal, inflamed, and have a thick outer coating, as you've seen here. So signs and symptoms of that are irregular, scanty, or absence of periods, infertility, hirsutism, that's hair on the face, for example, and a high testosterone level might be found on testing. So you see here that the coat of the ovary becomes hardened, and these follicles accumulate within the ovary, and the ovary itself will enlarge. In summary, insulin resistance, or IRS, is a common factor in polycystic ovarian syndrome, PCOS, obesity and type 2 diabetes. Raised insulin levels increase inflammation in the body and drives hormonal changes, especially in women. Insulin encourages fat deposition, and those wishing to lose weight are fighting their own metabolism in these circumstances. In women, IRS can lead to polycystic ovarian syndrome, PCOS, with menstrual irregularities and infertility. In the next video, I will talk about how natural medicine can be a help to those who want to reduce their insulin resistance and to help with PCOS and weight loss. So thank you very much for listening. Thank you.